Hi, I'm Stephanie Pollock. Today we will be discussing the behavioral and cognitive behavioral therapies. First, let's get started talking about the theorists. The initial work of behavioral family therapy, also known as BFT, was conducted by Gerald Patterson and John Reed. Some of the leading proponents of cognitive behavioral family therapy, CBFT, and cognitive behavioral couples therapy, CBCT, are Aaron Beck, my favorite, Frank DiTio, Albert Ellis, Norman Epstein, and Andrew Schwibbel. Many well-known behavioral and cognitive behavioral theorists exist. John B. Watson, Mary Cover Jones, and Ivan Pavlo are considered the early pioneers. B.F. Skinner is the individual who helped behaviorism gain national prominence. Skinner was also the originator and proponent of operant conditioning. Much of BFT and CBFT was built around the work of Joseph Wolff and Albert Bandura. Other significant contributions come from Gerald Patterson, Richard Stewart, Norman Epstein, Neil Jacobson, John Gottman, Walter Mischel, Robert Weiss, Ed Catton, Gayola Margolin, Michael Crow, Albert Ellis, Aaron Beck, Frank DiTio, David Burns, and Donald Meekenbaum. Let's look a little further in depth into one of my favorite theorists, Dr. Aaron T. Beck, born in 1921 and still alive today. In fact, he's actually about to turn 100 years old next month on July 18th. Dr. Beck went to Brown University for his undergraduate school, where he double majored in English and political science. He earned his medical doctorate degree from Yale University in 1946. Dr. Beck married Phyllis W. Beck and had 4 beautiful children with her. His daughter, Judith S. Beck, is also an influential cognitive behavior therapist who serves as the president of the Beck Institute for Cognitive Behavior Therapy. He is known for Cognitive Behavior Therapy, CBT, the Beck Depression Inventory, the Beck Hopelessness Scale, and the Beck Institute for CBT. He has published more than 600 professional papers and 24 books in his lifetime. Dr. Beck received 5 honorary degrees, the Lienhardt Award from the Institute of Medicine for his development of cognitive therapy, and the Kennedy Community Health Award. He is named one of the 5 most influential psychologists of all time by the American Psychologists. Today, Beck serves as the Emeritus Professor of Psychiatry at the University of Pennsylvania. Now we will look into the role of the therapist in behavioral and cognitive behavioral therapies. Here, the therapist is the expert, teacher, collaborator, and coach. He or she helps families and couples identify dysfunctional behaviors and thoughts. They work with families and couples to set up behavioral and cognitive behavioral management programs that will help bring about change. They utilize the influence of family members or partners by offering positive and negative reinforcements. They assist family members and couples in identifying how emotions are commonly linked with specific cognitions. They help family members and couples explore a variety of cognitions associated with negative emotions. The anatomy of intervention model is a process of working for change often used. It includes, number 1, the introduction, number 2, the assessment, number 3, motivation, number 4, behavior change, and finally, number 5, termination. The therapist must exhibit relationship skills, such as warmth, humor, non-blaming, and appropriate self-disclosure. They concentrate on modifying or changing family members and couples' cognitions and interactions. Therapists must have persistence, patience, and knowledge of learning theory, and particularly working with family members and couples. I would like to highlight some marriage and couple therapies. Cognitive Behavioral Couples Therapy, CBCT, and Cognitive Behavioral Marital Therapy, CBMT, are specific to working with couples. They grew out of the behavioral approach, first as a supplemental component and later as a more comprehensive intervention system. It is empirically supported, highly effective, and short-term in nature. Cognitive behavioral couples therapy is not a singular model. It draws upon psychodynamic constructs as well as cognitive and behavioral principles. At times, it may incorporate humanistic approaches, and it has roots in cognitive therapy. The rational emotive behavior therapy, REBT, can often be used working with couples. It was introduced by Albert Ellis. It's used to help couples dispute irrational thoughts they have about themselves, their spouses, or their marriages. Ellis employed an ABC procedure on the next slide, and cognitions have to be cleared up if couples are going to relate in healthy ways. Please note, this approach can also be used with families and is not specific to couples. Here you will see the diagram representing the ABC procedure. First, you will notice the A, which is the activating event or situation. Then we have B, the thoughts, positive, negative, neutral, or mixed, about the event that cause C, the consequence or emotions. In addition to the sequential ABC schema, which postulates that emotions are derived from thoughts, Ellis stated that individuals and couples had 4 choices in regard to what they thought. They could think and therefore feel positive, negative, neutral, or mixed. Some other methods that cognitive behavioral therapists use with couples are cognitive distraction, which is thinking of something other than negative aspects, self-control strategies, for example, relapse prevention, which enables clients to learn self-control strategies to prevent relapse, psychoeducation, reading books, attending workshops, and listening to audiovisual material. Now we're going to get into some family therapy highlights. First, we're going to start off with the theoretical tenets of behavioral family therapy, which is based on classical and operant conditioning. All behavior is learned, and people, including families, act accordingly to how they have been positively reinforced. Maladaptive behaviors and not underlying causes should be targets of change. The primary concern of behaviorists is with changing present behaviors, not dealing with the past. Not everyone in the family has to be treated for change to occur. In this approach, emphasis is placed on the importance of family rules and pattern communication processes. Emphasis on stimulus, reinforcement, shaping, and modeling is very important to this approach. Some of the theoretical tenets of cognitive family therapy are: attention focuses on what family members are thinking, feeling, and behaving. It is important to gain insight into how cognitions influence the problem. Relationship-related cognitions individuals shape how they think, feel, and behave in couple and family relationships. Relationship-related cognitions contain assumptions about how relationships work and the roles people play in them, expectations and perceptions regarding what particular events occur in relationships, and standards about how individuals in relationships should behave and how relationships ought to work. There are health-promoting relationship-related cognitions that promote growth, and there are also negative relationship-related cognitions that lead to distress and conflict. Therapists must deal with irrational beliefs on the part of resistant family members in order for therapy to be effective. Now I will list the 4 most prevalent forms of cognitive behavioral family therapies. First, we have behavioral parent training, BPT, also known as parent skills training. Then we have functional family therapy, FFT, which is a multi-systemic approach focusing on relevant systems, including the individual, family, and community, and in all domains of client experience, such as biological, behavioral, affective, cognitive, cultural, and relational. Then we have behavioral treatment of sexual dysfunctions, which assists with more than just intercourse. It helps with intimacy, relationship satisfaction, self-esteem, and family life. And last, we have cognitive behavioral family therapy, which you've already heard of, CBFT, which has the same principles and techniques used in cognitive behavioral marital therapy, CBMT. except on a broader and more extensive basis. Some behavioral and cognitive behavioral family treatment techniques rely primarily on the following: operant conditioning, classical conditioning, cognitive behavioral strategies. The general approaches include education, communication and problem-solving strategies, operant conditioning, and contracting. Behavioral and cognitive behavioral family treatment techniques continue. Specific techniques include, but are not limited to, classical conditioning, coaching, contingency contracting, extinction, positive reinforcement, quid pro quo, reciprocity, shaping, systematic desensitization, timeout, job card grounding, charting, Premack principle, disputing irrational thoughts, thought stopping, self-instructional training, and finally, modeling and role-playing. Here are some thoughts about the process and outcome of behavioral and cognitive behavioral family therapies. First, family members learn to modify, change, or increase or decrease certain behaviors and thoughts in order to function more effectively. They increase their skills in specific areas such as parenting, interpersonal, functioning, and sexual behaviors. Family members eventually are able to modify their behaviors and cognitions without the aid of a therapist. Some unique aspects of behavioral and cognitive behavioral family therapies that the therapist place emphasis on are the use of learning theory and research, evolutions from a focus primarily on parenting skills to a focus on the family as a system, teaching new social skills and cognitions, and elimination of dysfunctional ones, short-term treatment and rejection of the medical model, and finally, the treatment of a variety of presenting symptoms and problems. What emotional challenges are behavioral and cognitive behavioral therapies used for, you may ask? Let me tell you. They're used to manage symptoms of mental illness, prevent a relapse of mental illness symptoms, treat a mental illness when medications are not a good option, learn techniques for coping with stressful life situations, identify ways to manage powerful emotions like anger, fear, or sadness, resolve relationship conflicts and learn better ways to communicate, cope with grief or loss, overcome emotional trauma related to abuse or violence, cope with a medical illness, manage chronic physical symptoms, cope with a physical health problem, or assertiveness training. What mental health disorders may improve through the use of behavioral and cognitive behavioral therapies? Actually, there's a wide range of health disorders that this may improve. First, there's depression, then anxiety disorders, phobias, post-traumatic stress disorder, also known as PTSD, sleep disorders, eating disorders such as anorexia or bulimia, obsessive-compulsive disorder, OCD, substance use disorders, bipolar disorders, schizophrenia, and finally, sexual disorders. Criticisms of behavioral and cognitive behavioral therapies. The most significant disadvantage is the homework assignments assigned to clients to complete away from session. Due to the structured nature of CBT, it may not be the best option for people with complex mental health needs or learning difficulties. There are many claims that it is associated with illogical and negative thoughts as compared to triggering events. There is confusion while differentiating between the cognitive logic behind negative cognitions and the symptoms of a disorder. Terms such as dysfunctional self-image, negative self-view, illogical belief patterns about self, and unfair thoughts about oneself are viewed as same interchangeable terms, when in reality, every word has a much different and even deeper meaning. Positive evaluation of oneself may cause dysfunctional, illogical patterns of thinking. Now we will dive into the strengths and weaknesses of CBT. Some of the strengths. It is as effective as medication to treat some mental health disorders. CBT does not have much time to complete compared to other forms of talk therapy. The focus of CBT takes on different formats depending on the issue. Different therapy session types and tools are available through CBT. The skills learned through each CBT session offer helpful real-world skills. CBT is a collaborative effort. Medication can work with cognitive behavioral therapy. And last, CBT is useful for almost any age group. Some of the weaknesses are CBT relies on the will of the patient. It takes a lot of time to complete CBT with extra work between sessions. CBT is not useful for individuals with specific learning disabilities. People with complex mental health needs may not benefit from CBT. CBT often makes people feel worse before they feel better. CBT addresses current issues only instead of addressing some underlying causes. And finally, CBT focuses on the individual capacity to change. The title of my first peer review article is Trauma-Focused Cognitive Behavioral Therapy for Children and Families. This article found that CBT is an effective and widely used treatment for addressing childhood trauma. The title of my second peer-reviewed article was Cognitive Behavioral Therapy in Combination with Systemic Family Therapy Improves Mild to Moderate Postpartum Depression. It found CBT in combination with systemic family therapy can improve depression and sleep quality in patients with mild to moderate postpartum depression. The final and most fascinating peer review article I found was titled Combining Cognitive Behavioral Conjoint Therapy for PTSD with MDMA, a Case Example. This article offered a description of the combination of CBCT for PTSD, post-traumatic stress disorder, and MDMA, a psychedelic drug, and demonstrates that it can produce reductions in PTSD symptoms and improvements in relationship satisfaction. This article was so interesting to me. In summary, I would use behavioral or cognitive behavioral therapies when I see a family or couple struggling with distorted thought patterns by replacing them with more logical belief systems. Based on the peer review articles I studied, I could use this approach with various situations, such as families struggling with childhood traumas, women experiencing postpartum depression, or couples dealing with post-traumatic stress disorder. I would assist these clients by helping them develop or improve their sense of self-empowerment. These clients must take responsibility for thinking about these thoughts that led to the negative feelings that they are currently experiencing. I would work diligently to help my clients understand that they can choose whatever they want to think and feel. It is essential to emphasize the present moment because the past is not significant and the future is never guaranteed. Since these approaches focus on the here and now, it would be most beneficial to use with those in a mental crisis or even suicidal. I would use the ABC model to dispute irrational thoughts or the thought-stopping technique to alleviate any obsessive behaviors. Most importantly, I would use this with those who are willing to put in the work.
That's all, folks.